Thank you all for coming in today, and thank you, Mom, for reaching out and providing me with some background information for the session. Um, I want to start by saying that I am here to support all of you. Um, the goal of today will be to kind of talk and get to know each other and get better acquainted. I'd really love to know, get a good feel for how everyone is feeling at this time. Now, I understand that Lisa recently had an overdose in which she had been in inpatient care for a couple of days, and having mixed emotions towards this incident that y'all have experienced as a family is to be expected, and I want you to know that that is perfectly normal. So today, like I said, I'd like for us to talk and I'd like to know how everyone is feeling at this time. We can just use that as a good little opener and get some feelings out there to figure out um, what's kind of going on and put those feelings into context. Would someone like to start by sharing how they are feeling and how this experience has been for them? Mom, Dad, I know this is a really difficult time. Emotions are running really high. The best thing we can do right now is to try to communicate in a clear and defined and direct way as possible. But so that the other person can understand what you are trying to say and that they can interpret it the way that you are trying to say. So I really do like the fact that y'all are being vocal. And there's a technique I'd like for us to try, if that's okay with you. So this technique is called the I position. And I would like for both of you to say directly to each other how you feel about the topic at hand. So, Mom, you just stated that Dad doesn't appreciate you. With the I position, you could put it as I wish you would show me more appreciation for all the things I do around the house. And Dad, you just said that Mom is too emotional. Do you think that you could put it as I would like you to be more open with me about how you're feeling at times? So, how do you guys feel about that? Is that something you can do? All right. Mom, would you like to go first? We covered a good chunk of information today. I want to thank you all for your openness. And Lisa, I know you've been through this, has been a whirlwind, and I would like to thank you for being so open to your family. And family, I would like to thank you for receiving what she has told you and the things we talked about today. And I'd like for everyone to take the next week or so to kind of get used to your emotions and monitor and see how you're feeling at different times during the day when you're thinking about the incident. And remember the breathing exercises that we did. Um, those are the breathing exercises, a really good tool to use for bringing down anxiety that you might be experiencing in that moment when you're thinking about the incident. And let me know how that goes for you. I'd love to hear all about it. Mom and Dad, y'all did a great job using the I technique. I'd like for you all to continue to practice using that skill when you're communicating. And you can also use that with the kids. That's why the I position is awesome. But y'all have a great weekend, and I look forward to seeing y'all next week.